Scripps News is in week 3 of our 10-week Path to the White House initiative. As we count down to the presidential nominating conventions, we're taking a closer look at the issues that matter most to you, the voters. We're collaborating with local Scripps stations, including 7 and 8 of the key swing states likely to decide the next president. This week, we're going in depth on health care and how the candidates' policies differ. And joining me now to talk about this a little bit more is Cynthia Fisher, the president and founder of Patient Rights Advocate, which is a nonprofit organization seeking health care price transparency. Thank you for taking the time to be with us today. Your organization released a report in February showing that only 34.5% of hospitals in the U.S. are compliant with price transparency laws, which requires hospitals to post all prices online. Why aren't more hospitals doing this?
As long as hospitals and insurance companies keep their prices hidden, they can charge whatever they want. And that's exactly what's happening in healthcare. However, all hospitals across the country are to post all actual prices online so that everyone is to know upfront what they're going to pay before they get care so that they can benefit from competition and consumer choice to lower the costs of care. And finally, Chris, prices are so truly transformative in healthcare because they also protect patients from overcharges in medical billing.
And the ability for a hospital to charge more, insurance companies, maybe that's the quiet part out loud here, but publicly, what are the arguments that are being made against having to post prices out in the open?
Well, every day hospitals bill their patients so they know what they're going to charge. And insurance companies, these prices are negotiated well in advance. And even though they've objected to showing their prices and even lost in the courts to keep them hidden and secret, the reality is price transparency is so truly transformative in healthcare because it's already working. It's lowering the cost of care through consumer choice. And we see consumers not just as patients, but as employers and unions that purchase health plans and coverage so they can see the comparative prices. And when all of us become consumers and shop up front, we'll know we can get that MRI for $300 versus overcharge $7,400 for the same MRI. And Chris, what we're finding from these hospital price transparency files is we are learning that the prices vary on average 10 times from the same hospital on the same day with the same physician team. 10 times from one insured plan to another. And no one would tolerate paying 10 times more at the gas tank or at the grocery store for the same goods and services. And yet it's happening every day in healthcare. So soon we're going to see the power of the consumer refuse to be overcharged and be protected from medical bills to get a fair and reasonable market price.
Why is it, though, that they don't post? Because it seems like if you need the procedure, you need the procedure. Why wouldn't they just post the price?
Well, all prices can be posted by dollars and cents. And unfortunately, Health and Human Services has been slow to truly enforce the law. And every day a consumer can't get a price, they're harmed. But the good news is more and more hospitals are coming online and posting all of their actual prices. And so we're starting to learn that it's 10 times price variation in the same hospital. Oftentimes cash prices are even lower than the insured rate. And we can ask to pay cash up front. The other thing is we're finding that prices vary across hospitals in the same state, 33 times difference on average. That's outrageous. That means if somebody paid $50 at the gas tank to fill up their tank of gas, in the same gas station they might pay, if it was like a hospital billing, they might pay $500 the next person. And then 33 times more means the next person in line across the street might pay $1,500. No one would tolerate that at the gas pump. And so we believe very soon we're going to start to see mobile apps, shopping tools, and prices like being able to see prices like airline pricing where you have financial certainty before you purchase your health care. But it's going to take all of us to be our own patient advocates and every employer to demand access to these prices before they purchase coverage.
How does President Biden compare to former President Trump when it comes to this issue?
Well, the good news is this is such a bipartisan issue. And in fact, President Biden leaned into the Trump administration rules of law to give us all access to prices. And where did these rules of law come into play? They were in the Obama-Biden Affordable Care Act, and Trump made it into rule of law. So we have 3 presidents that have worked very hard to make sure we have access to prices in healthcare. And 94% of the American consumers want to get prices up front because all of us want to be in charge of our own money and our own spend in healthcare to lower our costs. And no one wants to be overcharged. And Chris, nearly everyone has a story of themselves or a family member getting surprised by a medical bill that was way more than they ever expected to pay.
All right, Cynthia Fisher with Patient Rights Advocate. Thank you.
Thank you so much, Chris.
And stay